this morning once again is Dr. Kothary. He is the Chief Medical Officer for Dignity Health Central California Division. Dr. Kothary, thanks so much for joining us again.
Well, good morning, Alex. Thank you for having me.
So there's a few things that I want to touch on. Let's first talk about the total number of cases. So again, we saw more cases added to the total. We have 633 cases. Again, that is total for Kern County, and 234 people have recovered. What is your analysis on this as you look at the numbers?
You know, I think as we move forward, we're going to see more and more people recovering. Unfortunately, I think for the next few days, we should still continue to see a rise. Hopefully, after that, we'll start seeing some kind of a plateau and then that flattening of the curve that we've been talking about.
Okay, so when we look at the total number of cases, you know, there are several graphs that we look at, but for our viewers at home, I'm talking about the green graph right here, the total number of cases. We did see, you know, several days ago, it spike day after day after day. Now things continue to be on that upward trend, but it's not spiking as much as what we saw several days ago. Now, I want to go to the other graph that shows the new daily cases that are reported every day, and this is the graph that we talk about when we're talking about the curve. Now, Dr. Kothary, we see here that what it looks like that we're starting to see a decline, that we're on the other side of the peak. Is that true, or should we still be a little more cautious?
You know, I think that curve has been changed by the Department of Public Health and the way they've started reporting. So what I expect is, you know, I think we'll see a rise still in the next few days, and then I think we'll see a flattening of that curve. I think we should start seeing a decline. Obviously, having said that, I think people should still be cautious and still social distance for now. But I think our big next topic that we need to handle is opening up the country, and including Kern County.
So let's talk a little bit about, really quick, I want to get to that, but first let's talk about the pending test. There are more than 3,400 people that are still waiting for their results in Kern County. That is 48% of the state's total when it comes to pending tests. What is going on in Kern County for there to be a backlog of pending tests?
You know, one of the benefits, even though we have a lot of cases here in Kern County, one of the things that we haven't had, we've been extremely fortunate, is the number of deaths. We've had 3 so far, and so being that we've had a low amount of deaths, we're not considered a hot zone. So the tests are getting shipped to places that do need it, that are a hot zone, that have a lot more mortality rates.
Yeah, and we should know really quick that you talk about the death rate in Kern County, and yeah, we do have, you know, I was looking at the numbers, we have one of the lowest death rates for the state of California. Why do you think that is? I mean, because when you look at the numbers, it is, you know, you look at one number and it shows that Kern County is considered a hot zone if you look at just total number of tests, for example. But if you look at the death rate, we have a very low mortality rate. Why do you think that is?
So I think one of the reasons is, you know, when we came out with who's at risk, and we started saying people over the age of 60 with comorbid conditions, a lot of these people took heed. And I think a lot of these people went and self-isolated and self-quarantined themselves away from everybody. And I think that's one of the biggest things that helped drop that death rate.
I want to talk about reopening the country and Kern County, because there's a lot of uncertainty here, and a lot of people, of course, are eager to get back to normal. Now, as you look at all of this, as you look at where we are on the curve, as we continue to grapple with all of this, where do you think we are, and how close do you think we are in order to open up the country, and what do you think needs to happen in order to do that?
Well, several things need to happen. You know, we have to have everything in check, and things that happened for us to close the country have now not got to be there anymore. So the number of cases have to go down, our death rate has to go down. You know, we've got to make sure that we have ample supply of hospital beds, ICU beds, just in case we get another surge. So we've got to be prepared on all fronts. We have a checklist that we're using. We're using the template from the governor's office that was sent out. And we also, in the hospital setting, we have our own template. So we're using a bunch of different tools to make sure that if we do open up, we're opening up safely. And if there is a spike for whatever reason, we're ready for that spike again as well.
Now, Dr. Kothary, several weeks ago, there was a lot of talk about hydroxychloroquine being possibly an answer to treating this. But now, over the last several days, we've heard about remdesivir and how it could potentially help in the fight against coronavirus. Talk a little bit about remdesivir and what you're seeing as we continue to see if this may be a solution or at least may be able to help in this fight.
So that's a drug that's produced by a company called Gilead. And, they were the first ones to come out with a drug that they thought was going to work. So they got a lot of people to enroll in their clinical trials. Unfortunately, they got so overwhelmed with the number of cases, they've shut that clinical trial down. And from what I've seen, the data looks extremely positive. They should release that trial. Once that trial is released, I'm sure they're mass producing remdesivir. And it will. I believe it's going to be one of those drugs that you take if you have coronavirus. It's like Tamiflu we take for the flu. I think it's going to be extremely similar to that.
What do you think is the next big development in all of this? Do you think that we're going to be able to see possibly a drug come out that could help in fight this? Or do you think that we're going to see more testing done in order to get the country back open? What do you think is going to come first? What do you think is more realistic?
I think the testing is more realistic. I think the drug will take a few months. And ultimately, we need a vaccine. And I know a lot of companies are working on vaccines as well. And that's what we need to help prevent getting this from the get-go.
All right, Dr. Kothary, again, joining us every morning here on Sunrise to talk about the latest numbers in Kern County, but also kind of help us guide us through this pandemic locally. Thanks so much for joining us, and we'll see you tomorrow morning.
Okay, thank you so much, Alex.